They'll say that by April 1st, they should be able to run 10,000 tests to detect COVID-19. Right now, the state can test about 100 per day.
I think that's going to relieve a lot of fears that are out there about the testing side of it, but we're working with the private sector.
Such widespread testing could give healthcare providers and officials a better idea of the scope of the outbreak, and clues about how and where to squelch it.
That has been probably the thing that's made it more difficult for us to assess patients and make sure that they were in the right place.
But on Monday, the top state health official admitted a limited supply of reagents has been restricting the testing process.
So at this very moment in time, we are limited by that, but that's very rapidly going to change.
Reagents are a critical chemical needed to process the mouth and nose swabs sent to the state lab.
We actually are able to do the swab, and then the test actually has to be run in a laboratory away. So 18 have been done. We still have probably 5 or 6 out pending report today, maybe tonight, and everything thus far has been negative.
So far, the state has tested less than 200 people, with 6 coming back positive. And with more than 6 million Missourians, doctors and nurses are looking around wondering who else is infected. But based on the limited supply, only allowed to test the sickest.
We are still not in a position to test asymptomatic individuals.
After facing criticism about the rollout of testing nationwide, state and federal officials say they're working to fix it.
I was on the phone earlier before we come in here with the president, the vice president, to kind of see some of the things that are happening on the national level. When it comes to the manufacturing side of things, that's all on fast pace to be able to get the supplies we need.
And that would be a game changer, because if lab supplies are stocked, doctors and nurses